Well, good afternoon. I am not a transit planner at all. That's why I don't wear ties or suits, apparently. I'm a doctor, and in the next 14 minutes and 49 seconds, I'm going to try to give you a sense of why transit is one of the more important social determinants of health, but I'm going to back it up quite a bit and give you a sense of why place matters so much in health. So, let's see, I think we can cue the video. Can I do that? There we go.
What determines how long we'll live? Is it what we do? Is it who we are? Actually, when it comes to predicting how long you'll live, your zip code is more important than your genetic code. Here's how this works. Meet Deb and Maria. They both have jobs, they're around the same age, they're both married, and they both have 2 kids. Deb lives in A-Town, while Maria lives in Bville, less than 1 mile away. They're similar in so many ways, but here's the thing. On average, residents of Bville will die more than 15 years sooner than the residents of A-Town. Why? Because where you live is about more than just your address. It's about your opportunities. For example, Deb and Maria's access to healthy options is really different. In A-Town, Deb's family is surrounded by healthy food options, including farmers markets, specialty shops, and grocery stores. The air in A-Town is cleaner and fresher, and there are lots of safe, clean parks where Deb can exercise and her children can play. A-Town has good public schools for Deb's kids and easy access to emergency and preventive health care. On the other hand, Bville has broken, badly lit sidewalks, and the parks are unsafe. The air is filled with truck exhausts from the nearby highway. And for food options, Maria's only choices are Bville's many liquor stores, fast food places, or convenience stores. The schools in Bville are overcrowded and undersupported. And even if Maria can get her kids into better schools far away, she needs to figure out how to get them there without access to a car. So for Maria, having to juggle so much to find healthy options can be an overwhelming source of chronic stress, which is a serious health risk factor. In fact, for all the residents of Bville, chronic stress drives health problems like obesity, diabetes, asthma, and heart disease. How did A-Town and Bville get so different? Well, in many cases in cities and towns across California, the root cause was racial and economic discrimination. Over the generations, poor white people and people of color were pushed to less desirable parts of town, where banks refused to lend money, businesses left, jobs too, schools declined, and the neighborhood crumbled. Everyone who could move away did. And what's more, when communities like A-Town and Bville are so unequal, Bville isn't the only one that suffers. Because it turns out that not only is your zip code a predictor of how long you'll live, so is what country you live in. Countries with the greatest income inequality have the lowest life expectancy. So even Americans like Deb, who are white, insured, college-educated, and upper income, die younger than their peers in other countries. In fact, our life expectancy is 43rd in the world, and that number is slipping. In the end, our biggest health risk may actually be inequality, and extreme inequality hurts us all. So what do we do? Well, if we're all going to be healthier, we don't just need to help the folks in Bville beat the odds. We need to change the odds for everyone. And that's what we're doing. There is a movement happening. We're Californians. We don't follow, we lead. We are building the power to make health happen in communities across the state. We are coming together to build one California, a smarter, more inclusive and equitable state that creates health and opportunity for all of us. Join us. To learn more, visit calendow.org.
Okay. Thank you. I hope some of you recognize the narrator there. That was Mr. Sulu from Star Trek, George Takei. So it's often hard to explain sort of why we approach the work that we do in the way that we do. We're a health foundation, but we work on things like transportation, we work on education, we work on housing, we work on criminal justice, because those are the drivers that set the conditions for people to be healthy. And this question for us, does your zip code matter more than your genetic code when it comes to your health, is a serious question that we're trying to not only address, but we're trying to make this not this way. Because unfortunately, we can't predict your life expectancy based on your address. This quote was attributed to me in 2013 in Forbes magazine as the #1 most important healthcare quote of 2013. And let me tell you how we came to this. It starts with death. You're all going to have one of these days, a death certificate. You got to give it a moment of thought. What data do you want to have on your death certificate? On a death certificate, we can figure out what somebody died of, how old they were when they died, their race, ethnicity, and where they lived. And those 4 pieces of data over thousands of death certificates, I was the health officer for Alameda County, there are about 10,000 deaths in Alameda County every year. You can paint a pretty vivid picture of how opportunity is patterned in a place. And so we took, the map of Alameda County and we transposed each of the census tracts, which were as close as we could get to neighborhoods there, and calculated on average how long somebody could expect to live in every neighborhood in Alameda County. And those green areas are neighborhoods where people can expect to live greater than 80 years. The red areas are where people can only expect to live about 74 years, and the yellow are between 74 and 80 years. And within the city of Oakland, you have neighborhoods that are practically contiguous, where there are life expectancy differences of greater than 20 years between those neighborhoods. And you can't explain those differences just based on access to health care or people's health behaviors. And it's not just Alameda County. We looked everywhere we could find. We looked in Baltimore, Minneapolis, Seattle, Philadelphia, Boston, New York, Cleveland, LA. Everywhere we looked, we found life expectancy differences in the same city on the order of 15, 20, 25 years. And so the question for us is, what's happening in these low life expectancy communities? How are people experiencing life? And the bottom line is that these low life expectancy communities are functioning like incubators of chronic stress. In these communities, virtually every system is offline. There are bad schools, poor housing, inadequate transportation, jobs that don't pay well and are difficult to get. Crime is rampant. They're policed like military zones. People have inadequate access to parks and recreational space and grocery stores, and in many cases, not even safe drinking water. So people living in these kinds of environments are facing an inordinate amount of chronic stress. And what chronic stress does to you is it actually changes your physiology. It changes not only how your body responds to acute stress, but it also makes it much more likely that you will develop cardiovascular disease, diabetes, multiple forms of inflammation, independent of your behavior. But unfortunately, it also changes your behavior. It makes you crave high-fat, high-salt, high-sugar foods. And beyond changing your physiology and your behavior, it changes how your genes express themselves. If you took 2 identical twins and put them in one in a green area in Alameda County and one in a red area, over time, their genes would express themselves differently. That's how important chronic stress is on our health. So, how does this work? Just very simply, the brain perceives stressors, which may be, in essence, in these communities, you're talking about a lot of risks and very few resources. And so there's an imbalance between risk and resources. So we perceive that imbalance as stress. And the brain sends a message to the pituitary gland, which sends a message to the adrenal glands, which releases a cascade of hormones, amongst which are cortisol. And so when you're living in these low-income communities, your body is literally awash in cortisol. And I'd like to remind people that in this country, low-income people are physiologically different than high-income people. Not because they were born that way, but because we made them that way through our policy. And oftentimes, it's the absence of policy in the face of abject need. So in many ways, our policy is more lethal than any knife or any gun, because we're creating for people the conditions where they can't physiologically tolerate the environment that we've constructed. So, what does this look like? Right now in health, we talk about the medical model. We spend a lot of money basically trying to manage premature death, high burdens of disease, and what we call bad behavior. Risk behavior that we think is the smoking, the drinking, the driving without a seatbelt, all that kind of stuff. So we have emergency rooms to try to prevent death. We have 15-minute clinical interventions to try to moderate that course of disease. And we have basically brochures and pamphlets to try to change people's behavior. And that's a $3 trillion enterprise, and it's bankrupting us. And it's not improving our health. Yet despite that, it's actually necessary, just not sufficient. So what we've argued in our work is that you have to think about what are the upstream drivers of that. And transportation is a critical driver of creating the conditions in those environments, linking people to opportunity. So upstream, you've got a narrative in this country that some people matter and some people don't. That narrative creates policies, and those policies create conditions for people living in communities, oftentimes bereft of all of the fundamental infrastructure that they need in order to be healthy. So kids living in this neighborhood have their physiology altered very early in their lives, and their life trajectory is set pretty early in their lives because of those chronic stressors. So our approach to trying to improve health is not going downstream and trying to increase access to health care by itself. We're looking to actually work with you in transportation and in all the land use planning agencies and education and criminal justice and the whole litany. I call them the butcher, the baker, the candlestick maker. You got to bring them all together to make a meal. And that meal has to be a meal that is the kind of meal that anyone could eat. So I appreciate being at these kinds of conferences. Let me talk quickly about some of the work that we're participating in Oakland. This is the International Boulevard Corridor, where there is a bus rapid transit system being developed. Now, we think that this is so important to the health of people living in East Oakland. We're investing very heavily in a number of different community-based organizations that are enlisting the participation of community residents that live in those communities to be actively engaged in the process of working on what this neighborhood should look like for them going forward. We think that it's really critical to try to create opportunities to raise the voice and to engage the people that are most impacted by the changes that are coming. And so that's our role in this work, is really to work with you who are experts in design and managing these large projects. What we're trying to do is facilitate as robust a community engagement as possible in order to make sure that people feel that they have some control. Because at the end of the day, control, or a sense of agency, a sense of being able to manage some of the things that are happening to you, both individually and collectively as a community, is absolutely critical for health. So I'll stop there.